Why is explaining complex medical info to patients so hard? Have you ever wondered why explaining complex medical information to patients can feel like climbing a mountain? It's a challenge that many healthcare providers face daily. Let's break down some of the reasons behind this difficulty. First, medical jargon is a major hurdle. Terms like carcinoma or metastasis are not part of everyday conversations. When healthcare providers use these words, they may assume patients understand them. This often leads to confusion and anxiety. The balance between simplifying language and maintaining accuracy is tricky and requires practice. Next, consider the variability in patient knowledge and health literacy. Some patients come in with a solid understanding of health concepts, while others may have little to no background. This difference means that healthcare providers must tailor their explanations to each individual's level of comprehension. In busy clinical settings, this can be quite challenging. Emotional and cognitive barriers also play a role. When patients receive serious or complex information, feelings of stress or fear can cloud their ability to process what is being said. For instance, older patients or those feeling anxious may struggle to remember instructions. This makes effective communication even more difficult. The complexity of medical conditions adds another layer. Many health issues involve various factors, including physical, psychological, and social elements. Explaining how these factors interact requires clear and concise communication. Some terms can have different meanings depending on the context, which can confuse patients further. Time constraints in clinical practice are another factor. Medical appointments are often short, making it hard to provide thorough explanations. Overloading patients with too much detail can lead to overwhelm. Physicians often have to prioritize key information and may use brochures or websites to provide additional details later. Patients also tend to remember only a fraction of the information shared during consultations. They often focus on the diagnosis but may forget treatment instructions or next steps. Using simple, specific instructions and supporting verbal communication with written or visual aids can help improve retention. In medical school, students learn to recognize these challenges and develop strategies to overcome them. They practice using plain language and avoiding jargon. Assessing a patient's understanding and adjusting explanations accordingly is key. Visual aids or written materials can reinforce what is said, and being mindful of a patient's emotional state is essential. These skills are particularly emphasized in preparation for medical licensing exams like the United States Medical Licensing Examination, Step 2 Clinical Knowledge, and Clinical Skills. Effective patient communication is tested alongside medical knowledge in these exams. Mastering clear communication is vital for building trust, ensuring informed consent, and helping patients make decisions about their care. So, the next time you find it hard to explain complex medical information, remember these factors at play. Understanding these challenges can help improve communication and ultimately enhance patient care.